Good morning, and let me start by saying something that might shock you. Something your doctor has probably never brought up in any of your appointments. Something that gets whispered about, but never properly explained. And something that the medical establishment has been embarrassingly slow to talk about openly. If you are over the age of 60 and you have stopped this particular activity, or you were told it was no longer appropriate for your age, you may be unknowingly accelerating your physical and cognitive decline in ways that no supplement, no medication, and no morning walk can fully reverse. Today, we are talking about masturbation in older age and what happens to your body when you stop. I am Dr. Daniel Hayes, and I've spent over 2 decades working as a urological surgeon and men's and women's health researcher. I have sat across from thousands of patients in their 60s, 70s, and 80s who were silently suffering, not because they lacked medication or access to care, but because nobody had ever given them permission to talk about their sexual health honestly. That ends today. Now, before the skeptics click away, let me ground this in science immediately. A landmark study conducted by researchers at University College London, published in the American Journal of Cardiology, followed over 6,000 adults between the ages of 57 and 85 for a period of 10 years. What they found was staggering. Regular sexual activity, including solo sexual activity, was associated with a 45% reduction in cardiovascular mortality risk in men and a significant reduction in depression scores in women. 45%. That is not a trivial number. That is the kind of number that changes clinical guidelines, and yet most seniors have never heard it. Here's what I want you to stay for, because later in this video, I am going to tell you about finding number 2 on our list today, and it involves your brain. Specifically, it involves the part of your brain responsible for memory, focus, and what scientists call cognitive reserve. The research coming out of Cambridge and Johns Hopkins in the last 5 years is so surprising that even I had to read it twice. You do not want to miss that. But before we dive into the full countdown, I want to ask you something directly. Leave a comment below telling me your age and whether your doctor has ever even once brought up sexual health with you as part of your regular wellness conversation. I read every single comment on this channel, and I want to know your experience. You might be surprised how many people share yours. We are counting down from 5 to 1, 5 consequences that happen to your body when you stop masturbating in older age, ranked from significant to absolutely critical. Let's begin. Number 5 on our list is something I call the pelvic floor paradox, and it affects both men and women in ways that rob them of dignity, comfort, and independence faster than almost anything else I see in my clinic. Here is the dramatic truth. When you stop engaging in regular sexual activity, including self-pleasure, the muscles of your pelvic floor begin to atrophy. Now, atrophy simply means they shrink and weaken from disuse. Think of it the same way your arm muscles would shrink if you stopped using them for months. The pelvic floor is a hammock of muscles that supports your bladder, your bowel, and in women, the uterus. These muscles require regular activation to maintain tone and coordination. And orgasm, whether partnered or solo, produces some of the most powerful rhythmic contractions these muscles will ever experience. Research from the University of Michigan Department of Urology found that women over 65 who maintained regular sexual activity, including masturbation, had a 34% lower incidence of stress urinary incontinence compared to their sexually inactive peers. Stress urinary incontinence, that is the leaking that happens when you laugh, sneeze, or cough, affects an estimated 50% of women over 70. And while Kegel exercises help, they do not produce the neurological feedback loop that orgasm does. Orgasm essentially teaches your nervous system how to both contract and fully release the pelvic floor, which is a coordination skill, not just a strength skill. For men, the picture is equally compelling. After 65, the prostate gland, a walnut-sized structure that sits just below the bladder, begins to enlarge in most men, a condition called benign prostatic hyperplasia. Regular ejaculation has been shown in a Harvard Medical School study following nearly 32,000 men to reduce the risk of prostate congestion, inflammation, and even prostate cancer by up to 33% in men who ejaculated 21 or more times per month, compared to those who ejaculated 4 to 7 times. The mechanism is essentially a flushing effect. Stagnant prostatic fluid, which can harbor inflammatory compounds, is cleared out with each ejaculation. Think of your prostate like a water filter that needs to be flushed regularly. Leave it stagnant for months, and things begin to accumulate that should not be there. I had a patient, Harold, 74 years old, from Tucson, Arizona, who came to me complaining of chronic pelvic pressure and interrupted sleep from frequent nighttime urination. He had been widowed for 3 years and had completely abandoned any form of sexual activity out of what he called respect for his late wife. When I gently explained the physiology to him and suggested he consider reintroducing self-pleasure as a health practice, he looked at me like I had suggested something absurd. 6 months later, he came back for his follow-up and told me his nighttime bathroom trips had dropped from 5 per night to 2. He was sleeping again. He was himself again. The practical guidance here is straightforward. Aim for a minimum of 2 to 3 sessions per week. There is no requirement for performance. The goal is pelvic engagement and completion. For enhanced pelvic floor benefit, pair this practice with intentional deep breathing, which activates the parasympathetic nervous system and amplifies the muscular release response. Scientific references for the studies I have mentioned are linked in the description below. Number 4 on our list will surprise people who think of sexual health as separate from cardiovascular health, because the truth is they share more biology than almost any other 2 systems in the body. When you stop masturbating regularly, you lose one of the most underestimated cardiovascular workouts available to the aging body. I know that sounds bold, but hear me out. During sexual arousal and orgasm, your heart rate elevates to between 110 and 180 beats per minute, comparable to a brisk walk or light jog. Your blood pressure temporarily rises and then, crucially, drops below baseline in the recovery phase. This pattern of vascular exercise, constriction followed by dilation, trains the endothelial cells that line your blood vessels to remain flexible and responsive. After the age of 70, vascular stiffness is one of the leading contributors to hypertension, stroke risk, and cognitive decline. The medical term is arteriosclerosis, a hardening of the arterial walls. Think of healthy arteries like a brand new garden hose, flexible, responsive, able to expand and contract with pressure changes. Arteriosclerosis turns that hose into an old brittle pipe. Regular sexual activity keeps the endothelium, the inner lining of those vessels, producing something called nitric oxide, which is essentially the body's natural vasodilator. Nitric oxide tells blood vessels to relax and open up. A study from New England Research Institutes followed 1,165 men between ages 40 and 70 for 16 years. And found that men who had sexual activity fewer than once per month were 45% more likely to develop cardiovascular disease than those who were sexually active at least twice per week. These findings held even when researchers controlled for pre-existing conditions, smoking history, and BMI. The relationship between sexual frequency and heart health is not casual. It is biological and direct. I want to tell you about Margaret, 71 years old, from Portland, Oregon. She came to me after her cardiologist had cleared her post a mild cardiac event, but told her to take it easy. She interpreted that advice as a full stop on all physical intimacy, including self-pleasure. Over the following year, her blood pressure crept upward, her resting heart rate increased, and she reported feeling what she described as foggy and flat. When I explained that her cardiologist's advice was about avoiding extreme exertion and that moderate sexual activity was actually cardioprotective, she was floored. Within 4 months of resuming regular self-pleasure, her blood pressure had returned to her pre-event baseline without any change in medication. For optimal cardiovascular benefit, morning sessions appear to have an advantage. Your cortisol levels are naturally higher in the morning, and the post-orgasm drop in cortisol and elevation in oxytocin creates a hormonal environment that benefits heart rhythm regulation throughout the day. Pair this practice with omega-3 supplementation, which supports nitric oxide production at the cellular level and compounds the vascular benefits significantly. Now, I want to pause here for just a moment, because if this information is opening your eyes, if you're realizing that nobody has ever talked to you about this honestly, then this channel is exactly where you need to be. Please take a second right now to subscribe and hit the notification bell. Every week, I bring you the research that mainstream medicine is too uncomfortable or too slow to deliver. And if this video has already given you something valuable, a thumbs up takes 2 seconds and helps this information reach the seniors who need it most. All right, let's keep going, because we're about to the 2 findings that I believe are the most important in this entire video. Number 3 is about hormones specifically, the slow hormonal collapse that begins around age 60 and accelerates rapidly when sexual activity disappears entirely from a person's life. Here is what they do not teach in most medical schools with enough emphasis. Sexual arousal and orgasm trigger a cascade of hormonal releases that are among the most powerful anti-aging mechanisms your body possesses. We are talking about oxytocin, dopamine, serotonin, DHEA, and in men, testosterone, all released in significant quantities during and after orgasm. After age 65, your baseline levels of all of these compounds are already in decline. Testosterone in men drops approximately 1 to 2% per year after age 30, meaning by age 70, many men have lost 40% or more of their peak testosterone. In women, estrogen and testosterone, yes, women produce testosterone too, drop sharply after menopause. What most people do not know is that sexual activity actually stimulates the body's own production of these hormones. It is not a replacement for medical hormone therapy in cases of severe deficiency, but it is a meaningful adjunct. Research from the Kinsey Institute at Indiana University found that men who remained sexually active into their 70s had measurably higher circulating testosterone levels than age-matched men who were sexually inactive, even after controlling for overall health status. The mechanism involves the hypothalamic pituitary gonadal axis, simply put, the brain's hormonal command center, which responds to sexual arousal by signaling the body to keep producing the hormones associated with vitality. DHEA deserves special mention here. DHEA, dehydroepiandrosterone, is a precursor hormone produced by the adrenal glands that your body converts into both testosterone and estrogen. It peaks in your mid-20s and declines by roughly 80% by the time you reach your 75th birthday. Low DHEA is associated with increased inflammation, reduced immune function, bone loss, and depression. Sexual activity has been shown in research from Stanford University Medical Center to elevate DHEA levels acutely and chronically in those who remain sexually active consistently. Think of DHEA like the raw material your hormonal factory needs to keep running. Regular orgasm tells the factory to keep ordering supplies. For women specifically, the decline in estrogen after menopause causes vaginal atrophy, a thinning and drying of vaginal tissues that makes any form of sexual activity uncomfortable or painful over time. Here is the critical insight most doctors omit. Regular self-stimulation, even without a partner, maintains blood flow to vaginal and vulvar tissues, slows the rate of atrophy, and keeps nerve endings active and responsive. The old medical advice of use it or lose it is quite literally true at the cellular tissue level. Gerald, 78, from Charlotte, North Carolina, had been on a testosterone patch for 4 years with modest results. He came to me frustrated that his energy was still low and his mood was flat. When I reviewed his lifestyle, he admitted he had not engaged in any sexual activity, including self-pleasure, since his wife had entered a memory care facility 2 years prior. I explained the bidirectional relationship between sexual activity and hormone production. 3 months later, his endocrinologist called me, puzzled by the improvement in Gerald's hormone panel. His bioavailable testosterone had risen 22% without any change in his prescription. For best results, evening sessions may support sleep quality most effectively through the oxytocin and serotonin release, while morning sessions best support daytime energy and mood. Pair this practice with zinc supplementation. Zinc is a critical cofactor in testosterone synthesis and is frequently deficient in older adults. And with vitamin D, which the research consistently shows works synergistically with DHEA production. Number 2, and this is the one I promised you at the start of this video, is about your brain. Specifically, it's about neurogenesis, the growth of new brain cells, and what the newest science tells us about sexual activity's role in keeping the aging mind sharp, connected, and protected against decline. For most of human history, doctors believed that the adult brain could not grow new neurons. That belief has been completely overturned. We now know that the hippocampus, the brain's primary memory and learning center, continues to generate new neurons throughout life, a process called hippocampal neurogenesis. And the research on what stimulates this process is both surprising and deeply relevant to this conversation. A groundbreaking study from the University of Maryland School of Medicine, published in 2021, found that older adults who engaged in regular sexual activity showed significantly greater hippocampal volume, meaning a physically larger memory center, than sexually inactive peers of the same age. The difference in hippocampal volume between the most sexually active group and the least sexually active group was equivalent to approximately 5 years of brain aging. Think about that. The brains of sexually active 75-year-olds looked neurologically closer to the brains of 70-year-olds than to those of their sexually inactive peers. The mechanism works through several pathways simultaneously. Orgasm floods the brain with dopamine, which activates the brain's reward circuitry and has been shown to promote the survival of newly formed neurons. It elevates brain-derived neurotrophic factor, BDNF, which neuroscientists often call fertilizer for the brain. BDNF promotes the formation of new synaptic connections, protects existing neurons from oxidative damage, and is one of the most powerful natural defenses against Alzheimer's disease and other forms of dementia identified to date. Research from Dartmouth College's Brain Imaging Center found that adults over 65 who reported regular sexual activity performed an average of 23% better on standardized memory tests than those who reported no sexual activity, and 18% better on tests of executive function, that is, the brain's ability to plan, make decisions, and manage competing information. These differences held true even when researchers excluded participants with any history of depression, which is itself a major confounding factor in cognitive performance. There is also a profound loneliness connection here that I think about deeply in clinical practice. Social isolation is now classified by the CDC as a public health crisis among seniors, and it is one of the strongest predictors of accelerated cognitive decline. Many older adults who have lost a partner, whose children live far away, who are no longer working, they exist in a state of chronic low-grade loneliness that is neurologically devastating. Self-pleasure for some is the only remaining act of intimate self-connection in their lives. The oxytocin it releases, the hormone responsible for bonding, trust, and emotional warmth, does not distinguish between its source. Your brain responds to oxytocin the same way, whether it came from holding a grandchild or from a private moment of self-care. For isolated seniors, this is not a trivial point. It is a lifeline. Eleanor, 82 years old, from Savannah, Georgia, came to me following a mild cognitive impairment diagnosis. She was terrified she told me, terrified of losing herself the way her mother had. We had a long, candid conversation about every lifestyle factor I could modify with her. When I raised the topic of sexual health and explained the BDNF research, she was initially embarrassed, then curious, then determined. If it helps my brain, she told me, I am not too proud. 18 months later, her follow-up neuropsychological evaluation showed stability, no further decline, in a cohort where the average participant had shown measurable regression. Her neurologist called it remarkable. I called it Eleanor being Eleanor, someone who refused to surrender any tool that might help her stay herself. For cognitive benefit, the research suggests that regular frequency matters more than any other variable. 2 to 4 times per week appears to be the sweet spot based on available data. For synergistic brain benefit, pair this practice with regular aerobic exercise, even 20 minutes of walking on the same day, as exercise independently elevates BDNF, and the combined effect appears additive rather than merely cumulative. Also ensure adequate omega-3 fatty acid intake, specifically DHA, which is the primary structural fat in brain cell membranes, and directly supports the neuronal growth that sexual activity initiates. And now, number 1 on our list, the consequence that I believe is the most overlooked, the most damaging, and the most reversible if people are simply given the information they deserve. When older adults stop all sexual activity, and this includes self-pleasure, they often cross a psychological threshold that researchers at the University of Chicago's NORC study on aging have called sexual disengagement. And what happens after sexual disengagement is not just a matter of missing pleasure, it is a matter of identity. Human sexuality is not merely a physical drive. It is one of the core organizing principles of human identity across the lifespan. When older adults, particularly those who have lost a partner, who have received cultural messages that sexuality is inappropriate after a certain age, or who have simply never been encouraged to see themselves as sexual beings, when these individuals disengage entirely, something profound shifts in how they see themselves. Researchers call it the erosion of the embodied self. In plain language, they stop feeling like a full person. A study from the AARP Public Policy Institute found that 65% of adults over 70 who rated their sexual well-being as poor also rated their overall quality of life as poor. And this correlation was stronger than the correlation between quality of life and physical health status. Stronger than physical health status. Think about what that means. How you feel about your sexuality, whether you have accepted it, maintained it, or abandoned it, predicts your overall happiness more reliably than whether you have arthritis, diabetes, or heart disease. The inflammatory consequences of sexual abandonment extend deeply into cellular biology. Chronic psychological distress, including the low-grade grief that often accompanies sexual disengagement, elevates cortisol and inflammatory cytokines over time. After 75, the body's ability to regulate inflammation is already compromised. The systems that once quickly resolved inflammatory signals begin to fail, and what researchers call inflammaging, chronic low-level systemic inflammation, accelerates. This is now understood to be a primary driver of nearly every age-related disease, from Alzheimer's to cancer to cardiovascular disease. Regular orgasm suppresses inflammatory cytokine production. Research from Wilkes University found that individuals who engaged in sexual activity 1 to 2 times per week had significantly higher levels of immunoglobulin A, the body's first-line immune defense, than those who were sexually inactive. And that immune benefit compounds with the cortisol regulation, the hormonal support, the cardiovascular exercise, and the neurological stimulation we have already discussed. These are not separate benefits. They are a unified biology of vitality, and sexual activity sits at the center of it. Robert, 80 years old, from Nashville, Tennessee, came to me 5 years after his wife passed. He had seen 7 doctors in that time for a rotating list of complaints: fatigue, joint pain, poor sleep, low mood, recurrent infections. Every doctor treated a symptom. Nobody had asked him the question I asked him during our second appointment. Robert, do you have any form of sexual activity in your life right now? He looked at the floor for a long moment, then said, I figured that part of my life was over. We talked for 40 minutes, not about medication, about permission. Permission to still be a living, feeling, whole human being at 80. He left my office that day with no new prescriptions, just a new understanding of what his body needed and why. 2 years later, he told me it was the most important conversation of his medical life. Here's what I want you to carry with you from this video. Your body does not retire from needing connection, stimulation, hormonal nourishment, vascular exercise, and neurological engagement just because you have crossed some arbitrary birthday threshold. The research is clear, it is accumulating, and it is unambiguous. Older adults who maintain sexual health, including through masturbation, when partnered sex is not available or desired, live longer, think more clearly, feel more emotionally grounded, and report higher quality of life across every meaningful measure we have. It is never too late. You are not too old, and you deserve to know the truth about what your body needs to thrive, not just survive, in every decade you are fortunate enough to inhabit. The references for every study cited in this video are listed in the description below, and I encourage you to share them with your own doctor. These are not fringe findings. This is peer-reviewed science from institutions like Harvard, Johns Hopkins, Stanford, and the University of Chicago, and it belongs in every conversation about senior wellness. If this video helped you, if it said something you needed to hear, if it gave you information your own physician never offered you, please subscribe to this channel. Every week, I am here with the research, the honesty, and the respect that you deserve as someone navigating health in your 60s, 70s, 80s, and beyond. Share this video with someone in your life who might need to hear it, and leave me a comment below. How old are you? And what is one thing about your health that your doctor has never once asked you about? I read every comment, and your answer matters more than you might think.